Before you keep scrolling, I need you to stop, just for 90 seconds. Because what I'm about to tell you is something that directly affects your body right now, today, if you are over 60. Most people never hear this from their doctor. Most people find out too late. You still have time to act on this. So please, stay with me. Pancreatic cancer is called the silent killer for one reason, and one reason only. By the time most patients notice something is wrong, the cancer has already spread beyond the pancreas. The 5-year survival rate for pancreatic cancer caught at a late stage is below 3%. But when caught before it has spread, that rate rises to over 40%. That difference, between 3% and 40%, comes down entirely to catching the signs before most people think to look. The first warning sign is jaundice, a yellowing of the skin or whites of the eyes. The pancreas sits adjacent to the bile duct, and even a small tumor can compress that duct and cause bile to back up into the bloodstream. Most people who notice mild jaundice assume it is a liver issue and wait. That wait is dangerous. The second sign is a new, persistent dull pain in the upper abdomen or middle back that is not explained by injury or muscle strain. The pancreas is located deep in the abdomen, and pain from a pancreatic tumor often radiates directly to the back, where it is almost universally attributed to a muscle problem or arthritis. The third sign is a sudden and unexplained change in blood sugar levels, new-onset diabetes in someone over 60 with no prior history, or a sudden worsening of previously controlled diabetes. The pancreas produces insulin, and a tumor disrupts this function in ways that show up in blood sugar before almost any other symptom. Now here is what makes this so critical. These three signs together represent what the American Cancer Society describes as the earliest detectable window for pancreatic cancer. And most people experiencing them are being told by their own bodies that something is wrong, but are not connecting the dots. The fourth sign is unintended weight loss and loss of appetite, not from dieting, but a sudden disinterest in food combined with rapid weight loss that has no other explanation. The fifth sign is greasy, pale, or floating stools, a sign that the pancreatic enzymes responsible for fat digestion are being disrupted by tumor activity. And the sixth sign, one almost nobody connects to the pancreas, is the sudden onset of blood clots, particularly in the legs, in someone with no prior history of clotting disorders. If you or someone you love is experiencing even two of these signs simultaneously, a conversation with your doctor needs to happen this week. Ask specifically about CA19-9, a blood marker used in pancreatic cancer screening. Ask about an abdominal ultrasound or CT scan. You may need to advocate for yourself. Do it. The silence of this cancer is not a reason to stay quiet. It is the exact reason to speak up, and speak up now.